And so now we will go on to Dr. Sunil K Agarwal, who is our next guest. And he is actually an old friend of mine. Many years ago when I was a young writer, he graciously sat down with me for a very long interview, even though it didn't help him at all. And he just continued to help others since then. This is actually just half of his introduction. He has so much going on in his life. He is a physician and a medical geographer. He is the co-founder and co-director of the Ames Institute in Seattle, which is a teaching clinic and research institute offering with specializations in oncology, psychiatry, neurology, rehabilitation, pain, and palliative care. In fact, in the field of palliative care, that academy named him a top 20 emerging leader. He's a member of physician groups associated with psychedelics, cannabis, palliative care, naturopathic medicines, and family medicine. As a former National Science Foundation graduate research fellow, he completed his PhD dissertation on the medical geography of cannabinoid botanicals in Washington State, access, delivery, and distress. And he is presently a co-investigator on the Ames Cancer Outcome Study, the Ames Medical Outcome Study, and the Canadian Psilocybin Safety Initiative Registry. He's published over 36 peer-reviewed articles and book chapters. He's a member of the board of directors of the End of Life Washington and the Center for the Study of Cannabis and Social Policy. And perhaps most famously, he is now suing to allow his cancer patients the right to try psilocybin. He has been all over the news with that. For his fun facts, Sunil enjoys playing tuned percussion instruments. He's a father of 2 young ones, aged 8 and aged 10 months. So hopefully he's getting some sleep. And he was born and raised in Muskogee, Oklahoma. Thank you very much for joining us.
Thank you. Thank you all for being here. I join you from the unceded traditional land of the Coast Salish peoples, specifically the first people of Seattle, the Duwamish people, who are the original stewards of the land, past and present. I honor with gratitude the land and the sea itself and the Duwamish tribe. Thank you to Lakshmi for having the vision to build a nonprofit organization to serve entheogenic flourishing for our world and the more than human world. Thank you to my fellow speakers. And thank you to our MC, Lex, who I have long wanted to collaborate with. We met for the first time nearly a decade ago in a Manhattan diner where Lex invited me to be interviewed for a graphic novel he was working on called People of the Cannabinoids. I'm proud to announce today that the Ames Institute, based in the Pacific Northwest, occupied Duwamish territory of Seattle, Washington, overlooking Lake Union, has formed a partnership with the registered nonprofit awake.net to further our shared mission values of social equity and health justice. The Ames Institute, as Lex mentioned, is a research, teaching, medical and psychotherapeutic care private outpatient clinic, co-founded in the summer of 2018 by my esteemed partner, who you'll hear from next, naturopathic oncologist and neuroscientist, Dr. Leanna Standish, and I. Ames Institute offers advanced integrative therapies, including, among others, ketamine and cannabis facilitated entheogenic therapy, and is especially focused on care for patients with chronic, serious, life-threatening illness and mental health conditions traditionally covered under the umbrellas of oncology, psychiatry, neurology, pain, rehabilitation, and palliative care. We provide coordinated, team-based, integrative medical and therapeutic care and education in individual and group settings, in person and virtually, by licensed and board certified allopathic medicine physicians, specialists, specialized naturopathic medicine physicians, skilled psychotherapists, advanced practice and registered nurses, a clinical social worker, and partnered health educators. We conduct IRB approved clinical outcome studies to study the effectiveness of our treatments. We offer an experiential training certificate in ketamine-assisted entheogenic therapy for providers, have a nationally accredited residency program for naturopathic physicians, and have created a mini residency for psychiatric nurse practitioners and a psychotherapist associateship. We precept medical students, residents, and fellows from other programs. We are an in-network clinic, and the vast majority of the medical and therapeutic care services we provide are covered by insurance, including Medicare and some Medicaid. However, many of the advanced approaches we provide, including entheogen-assisted therapy, medical cannabis education, sympathetic ganglion blocks, advanced intravenous therapies, are generally considered experimental and uncovered by insurance. Their out-of-pocket cost limits their accessibility by many suitable patients who lack financial resources. However, we recognize the right of everyone to enjoy the benefits of scientific progress and its applications, as stated in Article 15 of the International Covenant on Economic, Social, and Cultural Rights. Thus, we have established the Ames Social Equity Entheogenic Care Fund on awake.net, launching today, to create a pathway for the general public to give tax-deductible donations to improve the reach of our patient care and research missions. We additionally have established a patient financial aid application now available on awake.net for prospective patients. This will help us direct Ames charitable service and donations we receive to support the care of patients who need it most. Funds can be designated to particular patients, to our general fund, or to particular research funds. Another project I would like to highlight, as Lex alluded to, is our effort to secure legal access to psilocybin-assisted therapy for seriously ill patients who qualify under state and federal right-to-try laws to receive an eligible investigational new drugs for therapeutic purposes. The clinic, myself, and 2 patients with advanced cancer have filed a petition in the US Ninth Circuit Court of Appeals to review the decision made earlier this year by the US Drug Enforcement Administration, who offered us no license path to acquire psilocybin from a registered supplier for therapeutic use for bona fide legal right-to-try purposes. We have been represented in this effort by the Emerge Law Group based in Portland, Oregon, with lead counsel Ms. Catherine Tucker. A bevy of attorneys have done pro bono and low bono work to develop the legal arguments, write briefs, and gather supporters. We have received amicus brief support from the Washington State Office of the Attorney General, along with a coalition of attorney generals from several states. Experts like Drs. Matthew Johnson and Roland Griffiths, leading researchers, leaders in the palliative care community, and an established 2-hospital healthcare system in Washington, law professors, and many other allies. We hope that the court will listen to them and that the DEA will approve the prescription of psilocybin so that it can be used by others for the same purpose as well. The attorneys have set up a legal defense fund in partnership with the Colorado-based NOAC Society, a 501c3. Please go there to support their efforts. Our general fund on awake.net will also support the efforts of our clinic to continue this fight on behalf of our patients. We had a hearing before the court in early September, and we await a decision any day. In closing, I want to say that I do believe a future is possible in which we create a public health system in which the core principles of integrative health and medicine are foundational. In such a system, we would universalize respect and protection for spiritual health, as well as physical and mental health and safety. And there is no way to respect spiritual health without respecting and protecting one of humanity's oldest methods for achieving states of awe, entheogenesis. Thank you very much for your time.